Revised GOP healthcare bill leaves 23 million uninsured, 1 million fewer than first Obamacare repeal attempt. The Republican House healthcare bill would leave 23 million more Americans uninsured over the next decade when compared to Obamacare, the Congressional Budget Office reported on Wednesday. Earlier this month, President Trump invited House Republicans to the White House to celebrate the passage of the American Health Care Act. A healthcare bill still needs to go through the Senate before it becomes law. This was the second time House Republicans had tried to tackle healthcare with Trump in office, with the first iteration of the American Health Care Act spiked in part because of the CBO score. This time around, House Speaker Paul Ryan and his other GOP peers didn't wait for the nonpartisan agency to chime in, passing their piece of legislation on May 4. Now, 20 days later, the estimate makes the new bill look similar to its predecessor. The original CBO estimate for the American Health Care Act predicted 24 million would be uninsured by 2026. This time around, the CBO predicted that by 2018, 14 more million people would be uninsured under the GOP House bill when compared to Obamacare. That number would tick up to 23 million by 2026, the congressional scorekeeper said. Overall, in 2026, an estimated 51 million people under age 65 wouldn't have health insurance, compared to the 28 million who would lack health insurance under Obamacare. Under the Republicans' new legislation, several million Americans would use tax credits to purchase policies, but those policies wouldn't cover major medical risks. Part of the Obamacare law, more formally known as the Affordable Care Act, made insurers cover a suite of services, from emergency medicine to maternity care. Another controversial piece of Obamacare, a mandate that compels Americans to buy coverage or face a tax penalty, will go away. That's why each Republican-endorsed bill insures fewer Americans. As soon as the numbers were out, the partisan tug-of-war commenced. Democrats pointed to the 23 million, called it disastrous, and sent out a fundraising plea for the Democratic National Committee. Republicans urged caution if you hear Democrats squawking. The CBO has a long track record of being way off in its modeling, with predictions often differing drastically from what actually happens, noted Michael Reed, the research director and deputy communications director at the Republican National Committee. Republicans cheered at the fact that the CBO estimated that the bill would reduce deficits by $119 billion compared with Obamacare. The original GOP House health care bill saved $150 billion. The difference savings comes from the addition of funds to go toward building high-risk pools. Ryan, the House Speaker, pointed out that the CBO estimate confirms that Americans would pay lower premiums if his bill is implemented. The CBO explained that premiums would be lower because the insurance, on average, would pay for a smaller proportion of healthcare costs. Premiums would also vary significantly, the report said, according to health status and the types of benefits provided, and less healthy people would face extremely high premiums.